You're recording?
Yeah.
Hi, my name is Samson Samuel, and the topic for today's discussion is, can the physicians be great leaders? All physicians are leaders. When they come out of the medical school, they have some leadership qualities, especially when they're doing surgeries in the operating room or treating patients in the emergency room, or when they are members of the executive board. The physicians, when they graduate from medical school, they're taught how to treat patients and how to take care of patients, including doing surgeries. They are not trained in leadership or management in medical schools. But once they come out of the medical school, once they're in real practice, they face situations where they have to have some leadership skills. The traditional hospitals have a traditional CEO who has gone to an MBA school, who has very minimal medical knowledge, and he's going to make decisions in the hospital structure or organization based on shareholders' interest, based on economic factors, but not really considering the service issues, the health aspect, and quality of care and patient satisfaction. So it is very essential, for a CEO in a hospital to have certain degree of medical knowledge so that he can make decisions as to how to run a hospital in the current 21st century. So this physician leaders are extremely important nowadays when there is more physician-owned hospitals where the reimbursements are based on based on patient satisfaction and based on quality of care and based on hospital readmission rates. Now these are certain critical aspects that a CEO, a traditional CEO, will have a hard time to comprehend or contemplate to make the hospital institution more productive. Physician leadership is very extremely important. In order for a physician to be a leader, he needs a vision, he needs diplomacy, he needs emotional intelligence. The confidence, he needs confidence and also capabilities to run an organization and step up to the plate as far as running a structure and management of the hospital. A physician leader will also require general excitement, optimism, communication skills, clarity in communication, empowering the workforce, and also empowerment of the workforce, and building an environment of trust and confidence. These are some of the physician leader's skills for any leader who requires these qualities in order to be a great leader. So the competencies of self-awareness, self-management, social awareness, and mutual respect, and developing relationship with the hospital workforce are essential elements for a healthcare leader to build up a relationship between the leader and the followers. And essential elements are trust, mutual respect, and communication. The physician leader has also got to build an effective and normative commitment from the workforce so for the success of the organization. Communicating clearly and communicating with the people about his policies, his strategies, and his structure and management is very critical. A bottom-up management a delivery system is important. Problem identification and analysis of alternatives for solving problems, or left brain thinking powers, peer. The establishing a desired future and generating all possible options. How to, or the right brain thinking, requiring creativity in a physician leader. So integrity, characteristics of integrity, sense of mission, sense of clear and inspiring vision, and a sense of mutual respect and clarity in communication are important in management, and also in developing a great leader in a physician. So I believe that in the current medical climate, where the government and Center for Medicare and Medicaid Services are reimbursing the physicians based on the quality of care, patient satisfaction. The also the readmissions after discharge in a hospital, or the factors that decide how you're going to get paid. So when these are the qualities, these are the elements that's required, a traditional CEO may not be a good fit for a healthcare institution, especially with the advent of physician in hospitals. More and more physicians are involved in leadership activities, and I strongly believe that a physician leader would make a better CEO, a better leader in running a healthcare institution to achieve these benchmarks, and will bring an organization to a great success compared to old traditional CEOs in the days past. So I think the developing some programs such as MD, DO/MBA programs in medical schools, or having some sort of training programs for physicians, and also developing mentoring and orientation programs in hospitals should be established to promote leadership and management skills in physicians, so they become great leaders in the future for years to come. I believe physicians can make as great leaders, and physicians are great leaders, and they require these leadership qualities, essentially the emotional intelligence qualities that will be required by the physician leaders to become great leaders in the future. Thank you.